Good morning, everyone. Thank you very much for having me. How do I get the slides? Next slide, is it just... There we go. So I'm a consultant oncologist. I work in Cambridge and Bedford 3 days a week and UCLH 2 days a week. And in UCLH, it's a hospital. It used to be called the Royal Homeopathic. They've changed the name to the Royal Hospital of Integrative Medicine. So it's quite an unusual position, to be honest. I'm just going to share with you some of the experiences we have in our research group. Before I start, just to declare my conflict of interest. I have a paid position as a journalist. I've got some money from a book, but any of the supplements or anything I've mentioned in the study, which we've used in our trials, which is donated to the trials unit, we have no financial connection with. So just clarify that. And the other thing to mention before I start is when we talk about lifestyle, we're not here to blame people or blame ourselves for getting cancer or cancers coming back. You know, many of the cancers are caused by, genes we're born with, and you can have a completely healthy lifestyle, or you can be on the other end of the scale, having cigars and smoking pizzas and no, the other way around, and living till 90, but there is a correlation because, as the famous picture of those two people are the same age, you can have some effect on your biology. And the CRUK have issued a sort of statistical estimate that about half the cancers which currently exist are could be modifiable by a lifestyle. I think they said 42%. There was an American Cancer Society put that up to 46%. I think it's higher if you take into account things like vitamin D and gut health. But still, there's a lot of cancers that just happen for no reason at all. But what are the things which, we all get asked, why have I got this cancer? What are the things which could trigger mutations in our DNA and cause those mutations not to be repaired and go on to cause cancers and then not be picked up by the immunity and then form a full-blown cancer. And of course, there's thousands of things. We hear about it every time we pick up the DailyMail. Sugar, carcinogenic foods, not sleeping, circadian rhythm, too much alcohol, not enough alcohol. But I'm sort of particularly interested in diet and the microbiome, which I'll concentrate on a bit. And after cancer, of course, is even more confusion of, once you've got your cancer, can you change your lifestyle and alter your pathway and improve your side effects? And, there's a lot of confusion for patients, but there's still a lot of confusion with doctors. I was actually very surprised when I've gone to RLHIM, it's called, Royal London Hospital for Integrative Medicine. I'm still getting people being told, people with sarcoma, because there's a big sarcoma unit in UCLH. So actually about a third of my patients paradoxically have sarcoma, and being told, they mustn't have soya because there's ER positive receptors in their uterine sarcomas. And I said, well, come on, that's clearly wrong. But they're told, they're told every day. So there's a lot of confusion. So over the last 20 years, we've developed a lifestyle and nutritional research unit based between Cambridge University, Bedford University, various other partners across the world, and we ask patients what they want, what side effects they're getting. We do retrospective studies, evidence reviews, but ultimately do double-blind randomized trials, try to get the evidence to convince our colleagues and various people to, what's right and wrong. We publish that in medical journals, but also lay journals. We advise patient advocacy groups, and we now have our own sort of blogs and stuff like that, and it helps with writing for the newspaper. So let's concentrate more on the microbiome. We know that how many you all know this, how many alien bugs are on our body in proportion to our own cells? Do you all know the figure? It's about 50-50 apparently. So, it's not a surprise that these bugs influence our immunity, etc. So when it's in the gut, if you have a poor gut microbiome, in other words, the profile of pro-inflammatory bacteria are greater than the anti-inflammatory bacteria, you tend to feel bloated, have indigestions, you end up on lansoprazole, laxatives, etc. But there's lots of short and long-term consequences. We tend to feel fatigued when we have poor gut health, have low cognition, low motivation. I give lots of talks in the city, which are paid, which I declare. If you want to get a chief executive to perform better, attempt to get some sleep and have good gut health, number one things. But this leads on to lots of degenerative conditions like stroke and cancer. And one of the underlying mechanisms, if you have an inflamed gut, you actually have a lower, the Peyer's patches, which will make the immune cells are deficient, so you have a lower immune surveillance, so you don't recognize cancer cells as foreign, and you get a leaking of toxins into your bloodstream, which elicits a chronic inflammatory response, which then has collateral damage, damaging your joints, your brain, and also other things, and causes excess inflammation. So that combination of reduced immune surveillance and excess inflammation at the same time is a perfect storm to develop cancer and other things. And a good example would be COVID. So COVID is a classic example. If you have poor gut health, you're more likely to get severe COVID and long COVID because you get bugs coming into the bloodstream, they filter into your lung, your immunity doesn't pick them up as foreign, yet you get an enormous inflammatory response against them, which then just kills your own cells and you die of pneumonitis. And one of the things we did during COVID, I'm sidetracking a bit, was do a trial, a double-blind randomized trial where we gave people probiotics and prebiotics with antiviral properties, and there was a very significant reduction in acute and long COVID. But coming back to cancer, what's the evidence that if you have poor gut health, you're going to get more cancer? Well, there are studies of bowel cancer, which is common. I'm a prostate cancer specialist, mainly in my 3 days a week in Addenbrooke's. So I'm going to talk a lot about prostate, but a lot of the evidence for prostate does apply for other tumor types. So excuse me if you don't think it's specifically sarcoma directed. But there are studies, for example, like this. We were involved in one of these studies. 55,000 people, you follow them and you ask them questionnaires and analyze them, and they found that people with poor gut health were more likely to die of prostate, and I'm sure that applies to other cancers. Biological treatments is where we're all going, and same in sarcoma and other tumors. And most biological treatments or immunotherapies try to recruit the immunity to recognize the cancer as foreign and kill it. Perfect. But if your immunity is running at half-mast, you're not going to be able to respond well to these immunotherapies. Not only that, if you have poor gut health, you're much more likely to end up with severe diarrhea and then excess inflammation causing things like pneumonitis and heart disease. So this is a study from MD Anderson which shows that these were melanoma patients, but again it applies to everyone. If you have a poor gut health, you have a 40% reduced chance of responding to these immunotherapies. So most centres are moving into a prehabilitation. Now, this is one thing a sarcoma society could push on, and it's much slower than it should be. There are still people being given things like Pembro. They get diarrhea, they end up in ICU with pneumonitis. They were never put into a prehabilitation program to improve their gut health, and that should be a norm. So what can we do individually? Well, it's all about the balance between pro-inflammatory and anti-inflammatory bacteria. So we want to get more anti-inflammatory bacteria, such as the lactobacillus. Obviously, diet is important, but I'm going to go through a whole load of other factors. We need to eat more prebiotic type foods, mushrooms, artichokes, herbs, spices, beans, which help the bacteria grow. And we need to have some fermented food which are rich in bacteria. And Britain isn't very good at having fermented food, whereas some countries are better, like South Korea, etc. I mean, I should be head of the British Kimchi Society because I must tell everybody to eat kimchi 3 times a day, and especially the ones which fizz when you take the lid off, the live ones. So they're a bit pongy, I agree with that. But it's amazing food. It's packed full of lactobacillus, about 10,000 times more lactobacillus than kefir. And this is a good resource, keephealthy.com, which has got lots of recipes and examples of which foods help. Patients often say, if I take those, I get wind, etc. But it's all about pushing through it, then the fermentation change, and then you don't get the wind. But what other things affect gut health? Well, exercise. Now, these are the things which is a chicken and egg situation here. So we know that if you exercise, it improves your gut health. It improves the motility through your gut, and that's well recorded. But it's also known that to improve exercise performance, you can improve gut health. And we know that if you exercise more, there's lots of things happen to your body which are anti-cancer, improves oxidative stress, reduces inflammation, improves your mood, your serotonin and endorphin levels. So that's why it's one of the reasons why it's important. Processed sugar. We know that the pro-inflammatory, I use the word good bacteria and bad bacteria, it's just a bit quicker. So the good bacteria actually like to feed off polyphenols and phytochemicals, and the bad bacteria like to feed off processed sugar. So the more processed sugar you're having, you're just feeding the bad bacteria. Unfortunately, sugar substitutes like aspartame and things, they actually also feed the bad bacteria. So that's why those are harmful as well. So you're better just stopping processed sugar altogether. And there's lots of other problems with processed sugar. You get a sugar peak, it puts your insulin levels up, and there are some tumours are actually sensitive to high insulin levels, and it causes them to grow faster. And it leads to all sorts of other chronic diseases which are common after cancer treatments. Sleep. Now, sleep's obviously very important. You don't feel tired, you have more motivation if you've had a good night's sleep. But when you sleep, it improves your gut health. Again, it's a chicken and egg situation, because if you have poor gut health is one of the reasons why you don't sleep that well. But nevertheless, it's very important, and we are doing a lot of patients, as you know, suffer from sleep problems after cancer, as well as the rest of us. And so this is one of our next studies, which when we did the COVID study, one of the things we saw was an improvement in sleep with one of the supplements, which has got high-dose resveratrol, citrus bioflavones, and chamomile. And those are the 4 things which can improve sleep, yet doesn't cause sedation, because we don't want to give sedatives, which seems odd, because actually sedative gives you a false sleep, and then you wake up wide awake when they go out of your system. So that's one of our next studies using that supplement. Processed meat, pro-inflammatory foods, damages your gut. But also, if you do eat a burnt sausage from Iceland in a barbecue, washed down by a can of Coke and some Pringles, which is, again, the perfect storm of getting cancer. If you have poor gut health, that tends to go down that pathway they get metabolized into nitrous amines, which are actually the very carcinogenic chemicals which damage your DNA. If you have good gut health, it actually pushes you towards those foods being metabolized into nitric oxide, which is actually a vasodilator and improves tissue perfusion. So it's, again, what protects you from carcinogens. Vitamin D, I'm just rattling through this pretty randomly. Lots of studies giving vitamin D supplements to patients don't increase serum levels. That's because people have poor gut health. You need good gut health to absorb oral vitamin D. We know that low vitamin D correlates with high risk of lots of cancers. So and also vitamin D is a prebiotic, so it helps with bacterial growth. So if you were to, it's very important to think of the correlation between the two. Obviously, the best way to get vitamin D is to go out and sunbathe without burning. But if you were to take a supplement, I would combine it with a probiotic as the best source. Now, phytochemical-rich foods. These are foods which are colourful, have a nice aroma and smell, taste, and things like herbs, spices, fruit, vegetables, all the things we sort of know are healthy. And they've got lots of fibre, minerals and vitamins, but it's the phytochemicals seem to have the best anti-cancer properties. And we know that phytochemicals can reduce inflammation, they can reduce proliferation of some cancer cells, they can also help to inhibit carcinogenesis, like in the last slide, along with gut health, and they actually have prebiotic properties. So again, they work closely with gut health to help us. That's just confirming. So there's not only a synergy and they help prebiotics. A good gut health helps the breakdown of phytochemicals into smaller biologically active units. So again, there's a synergy between phytochemical-rich foods and gut health. And we know there's lots and lots of studies that if you have these foods, soya, herbs, spices, teas, etc., you have a lower risk of cancer and a lower risk of cancer relapse. I'm just going to diversify. This also applies in breast cancer, which are ER-positive tumours. if you have soya-based products, in other words, phytoestrogenic foods like soya, chickpeas, tofu, that sort of things, you actually have a lower risk of cancer development and a lower risk of cancer relapse, because phytochemicals in foods do not overstimulate the estrogen receptor. In fact, they block it slightly, a bit like a sort of tamoxifen. And it was CRUK, although otherwise a fantastic organisation, up until May 2024, had on their website, do not take soy if you've got breast cancer, despite about 15 letters from us over the last 10 years pointing out the 2 large trials in the world and all the laboratory data. And they have changed it now, without any apology that they had it wrong for 10 years, I have to say. So I would say that applies to ER-positive sarcomas as well. You don't take estrogens, or like HRT, and you don't take phytoestrogenic supplements, but phytoestrogenic foods would be perfectly safe and I would say beneficial. Anyway, are there evidence for supplements? Well, yes, and there's a lot of increasing interest. I went to ASCO San Francisco earlier in the year, and there were 3 studies which gave probiotic supplements during chemotherapy or during biological treatments, all showing an improved effectiveness and less side effects. There's lots of animal data as well. So I'm going to talk about a prostate trial, again, not specifically sarcoma, but there is a similarity in the sense that there's many men, 60% of men with prostate cancer are just being watched at the moment. They're very interested in lifestyle strategies to prevent them progressing from surveillance into needing a treatment. And I'm seeing patients now in UCLH where they've got a sarcoma, maybe there's some lung lesions which are a bit suspicious of, or they've had an initial treatment. So they're sort of on a watch policy, and they're also very keen to have lifestyle strategies to prevent them progressing or relapsing. I think the same evidence applies for different groups, so you have to be a bit careful. So why can't we just tell patients in a trial to just eat better? And we do anyway. Of course we get people to eat better and exercise. But the problem is in randomized studies, and there's 2 quite famous ones published this year, didn't show any benefit in 2 groups, one being told to eat better and one told not to eat better. There's various hypotheses for that, and it could be that they just don't change their diet enough, or the compliance isn't good. In these trials we have to use nutraceuticals or supplements because you can increase the intake of, say, phytochemicals, for example. You can measure the levels of phytochemicals within them, and you can standardize them, and you can spread consumption throughout the day. So I think there is a role. Which one do you use? For the prostate study, we looked at all the evidence from previous studies which have used them, and more recently we worked with manufacturers to have the 4 foods which was used in a study in 2013, but look at other evidence from other trials and use improvements in food technology where you have to combine whole foods and extracts in order to really boost the phytochemical intake. And this was one which was supplied to us. And for the probiotic, we obviously used the one we used in the COVID study, which has got a track record, and it was found to be safe, and also vitamin D in it. So one of the things we did recently, we got a group of 220 men, we randomized them to these or placebo, and we saw a significant slowing of the rate of prostate cancer, which was not a surprise because we showed the same thing in 2013. But the addition of this trial was that we added a probiotic in one randomized group, and it was an even better response. So in other words, phytochemical-rich foods slowed down the progression in these men, but then if you combined it with a probiotic, there was a highly significant further improvement. You could argue these are good prognosis men, it's not going to change their survival, but of course they were very appreciative of the data. And very excitingly, we actually did MRI scans before and after, and there was a difference in the number of patients whose disease had regressed on MRI. So this was not just a PSA effect, which is very exciting. There was an improvement in symptoms as well. And this, I'm not sure if you believe this, is a thing called a neutrophil to lymphocyte ratio, which is supposed to be a correlation of systemic inflammation, which was different between the two groups, and it's something we can easily measure. But I think if we were going to do the trial again, we would have more robust markers of systemic. And this testosterone levels higher. Now, this is something which would be interesting to the sarcoma community, mainly because of your comments earlier on about function. Now, in this group of men, as well as them having lower symptoms and feeling better, we actually measured strength, grip strength, and grip strength went up in the combined probiotic phytochemical group. Now, that's quite exciting because it showed all men were told to exercise more, and they did their best. But it shows that if you improve their gut health and their diet, their actual physical recorded strength improve, which has implications for independence and recovery, etc. But that's, again, to be tested. So that's it. So I hope I've given you a whistle-stop tour. I was conscious of the time, so I talked really quickly, which you shouldn't do when you give presentations. So we've got some various websites and newsletters and social media if anyone wants to support our research, and this is a YouTube channel we've just started, so I'd love to hear your questions afterwards.